Hi, it's Rachelle Schultz again, CEO at Winona Health, with another update for the community. So today I want to talk about our preparedness again. I understand that there have been more questions kind of coming up through the community, maybe in some other venues, possibly people haven't seen prior videos, so I wanted to take the chance to provide maybe a little bit more detail and updates as to where we are with our preparedness as a hospital. So we've continued all of our planning. Actually, we're in a pretty good place right now. We have evaluated all of our hospital beds, areas of expansion that we can put more beds in, some areas that we in the past have not used for hospital rooms because we haven't had that census over time. I think I mentioned in the past that we used to be licensed as a 99-bed hospital, and today we're licensed as a 49-bed hospital. So we do have hospital bed capacity. So we've gone through, we've phased the spaces that we have in the event that there is a surge, and how big that surge is. We're still going to have to wait and see what that looks like. But we certainly have been able to increase that capacity. And just so that everybody is aware, every single day we report to the state the number of beds we have, how many are open and available, how many ICU beds we have, how many vents we have, how many anesthesia machines that we have, how much PPE we have. There's a whole bunch of data that on a daily basis we are reporting into the state. And they're getting this from everyone in Minnesota so that they can coordinate those resources. So here at Winona Health, we have 4 vents, and we have vent patients, from over time. That's not an unusual thing for us to be able to take care of here in our hospital. On a rare occasion, we're up to using all 4 of those, but typically, we will not, maybe have 1 or 2 or something like that are being used. So we can, expand our capacity with those. We have those 4 vents. The anesthesia machines, we actually have 6. We'll be leaving 2 in our ORs for sure. And if needed, we can move, 4 up to the medical floor or our ICU. So we would have 8 vents that we could use for patient care. And we've just recently gotten in some additional respiratory machines that could be used also in that type of capacity. And then there's other types of equipment that we can use to help with sort of breathing or respiratory needs that patients might have. So we've really done a lot of deep diving into the equipment we have available, what we can get, what we believe we may need here for our community, how we can use the various rooms that we have. All of our hospital rooms have, the medical gases coming in, oxygen, all of those types of things. So from that standpoint, we think we're sitting, pretty good. And again, we've been very fortunate that some of our community partners have provided any equipment, medical beds. The universities through their nursing programs have provided that equipment to us. And so forth. So, PPE, we're still, being very diligent in our use of PPE. That's one of the things that the state is struggling to get. Of course, nationally, you see that on the news. Everybody's struggling to get more PPE. Another thank you to all of the sewers out there who've been making masks and gowns. And actually, if you want to make more masks, we would love to have those. And you can drop those off as you have been, and thank you so much for that. That helps a lot. We've been distributing those both internally as well as some of the area facilities who have some needs. So we've been kind of a distribution point for that, and that's been incredibly helpful. So that's kind of our supplies, equipment, space, and so forth. And then we've also been doing some planning relative to staffing. Staff, we want to make sure we're protecting our staff, that we're not burning them out or using, too long shifts, all of those kinds of things. So we've, kind of a phased approach with our model about how we would expand, sort of phase 1, phase 2. And again, this is all dependent on what might show up here in our hospital. And that, remains to be seen. of course. But I think we feel, pretty comfortable that we've got really good plans in place, that we've got people teed up. We've been doing a lot of cross-training. Many of our staff, as they are in this organization, might transfer from one area to the other, and so have skill sets, for multiple areas. But we're going through and taking this time also to do some additional, cross-training and, just, more skills application, things like that, just so everybody is, sort of ready, for whatever might come our direction. So, overall, from the hospital standpoint, I think we feel, like we are in a pretty good position for everything that we can do right now. And all of that's been in place. This week has kind of been a little bit of a waiting period. Maybe the next couple weeks will be that way. Again, it depends on, when we might see this surge, this anticipated surge come, and how big might that be. We're getting stories around the country that tell us it'll come. And in rural areas can get hit harder because of the demographics of our community. We'll see. I think that will depend on if all of the tactics we've been using or strategies, and people staying at home and staying well and those types of things, that might pay off and make that a lesser demand. But regardless, we've sort of modeled best case and worst case scenarios, and feel really pretty good that we have what we need. Now, just to be clear, if we had our worst case scenario and it taxed all of our resources and all of our beds and all of our staff, we are connected within the state system. So at a point that, for example, all of our ICU beds are used, or we have people in those, and vents, are all being used and so forth, through the state and their monitoring of all of these resources, we would simply, do a one call to the state coordinating center, and then they would find the next place or tell us where we would need to transfer that patient, so that if they needed to be, on a vent or in an ICU or something like that, that they would make that match for us. We wouldn't have to be calling all over the state. So I think there's been some really remarkable things that have been put in place with this coordination across the state for the large systems in the metro, as well as all of Greater Minnesota hospitals. And I can tell you that all of the Greater Minnesota hospitals are really teed up and ready to do their part for whatever they need to do for their communities, as well as helping out in the state. So I think Minnesota sits in a pretty good place. I think Winona sits in a really great place, and we're here to take care of you. We're here to be ready and diligent, and meet what those needs are for our community. And certainly we hope that demand is low, and we've all done our part. But regardless of what happens, we're here, we're ready, and we're prepared. Thank you.